Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our politics panel on provincial reaction to the speech from the throne. But first, the continuing surge in measles cases. As of this week, the province-wide total has now exceeded 600, with a vast majority in the South Zone, where a standing measles advisory remains in effect. As well, AHS Public Health has launched a call-out campaign in the South, Central and North Zones to let parents of 6 to 11-month-old children know of eligibility for a measles vaccine. Joining us now, Dr. Craig Jenne, a professor in the Department of Microbiology, Immunology and Infectious Diseases at the University of Calgary. Dr. Jenne, good to see you again, sir. Thanks kindly for coming back.
Glad to be with you.
All right. Now, the last time we spoke, and I'm thinking it was in late March, but at the time, it was below the 50 case mark. Now it's more than 10 times that. What's to be made of the rate of growth or progression, and what might that say about how it's spreading?
Well, I think what we've seen in the last 2 months is the transition from these localized exposures, so within family households or single businesses, to now community level spread. And unfortunately, measles is the most contagious virus we deal with. And now that it does have a toehold in the community, we can continue to expect these 100+ case weeks for the foreseeable future.
The province has released some stats on vaccination rates, telling CTV News more than 47,000 vaccines administered province-wide between March 16th and May 11th, a 57% increase over the same period last year. How much of an impact might that have on dynamics?
Well, ultimately, vaccination is the single best tool we have to bring this in, but we have a long ways to go. There are a number of regions in the province where vaccine rates are below 50%, and we know from past experience that to control measles, we need the community to have about 95% of the individuals vaccinated. So 45,000 doses, good start, but when we're talking about literally having to vaccinate millions of people, we still have a long ways to go.
Okay, so a long ways to go. Does there come a point where the case count peaks or levels off, or should Albertans just expect it to keep growing and growing and growing?
Well, I think unfortunately for the near future, they're going to continue to grow. And we base this largely on what we see in other places of the world. So in Ontario, they've been dealing with measles since early fall of last year. And if we look at Alberta's numbers on a per capita basis, recognizing we're smaller than Ontario, we've now eclipsed them in a matter of under 3 months. So the cases grow quite rapidly here. And as a result, it's going to require significant effort to bring that back under control.
How worrisome is that from a health standpoint?
It's quite worrisome. We do know that typically we can tolerate a few measles cases every year, but as those numbers go up, I mean, again, previous outbreaks have shown us 1 to 3 children out of every 1,000 infections will likely lose their lives. So as the numbers grow, the risk of those severe outcomes unfortunately grows proportionally.
Yeah, there had been site-specific exposure advisories in the South Zone, but since last Friday, that became a standing advisory. So if it is that the exposure source isn't known, what comes of the challenge of tracking and attempting to contain it?
Yeah, well, right now it's nearly impossible to track them in the South Zone. So we are seeing measles acquisition in many different public places. And as a result, these health advisories are simply stating that there's a risk of measles pretty much anywhere in the community. We have seen cases from the BC border clear through the province in the south to the Saskatchewan border. So we do know it's there. We do know it's circulating in the community. And really the only personal defense when we don't have these localized exposures is immunization.
Now, the South Zone, it's south of Calgary, includes cities like Lethbridge, Medicine Hat. If you don't live there, but you do plan on visiting or maybe working in the region, what's advisable?
Again, check your immunization status, or if you, for whatever reason, are not immunized or cannot be immunized, you may have to reevaluate travel. We do also have to appreciate that in Alberta, we do have a lot of mobility, which is fantastic, but it means that if there's community level transmission in the south, that can move to other regions of the province. We continue to see cases in the north this week, and we have large events coming between events such as Calgary Stampede and Rotary International that we'll see a lot of people come into the cities, and there's a risk of measles transmission with those events as well.
Now, during the pandemic, there was much made of impact on the health system, overloaded hospitals. If these measles cases are showing up in hospitals now and into the future in health clinics, what kind of impact does that have on the system itself?
So measles presents a huge strain, and largely because we do not want people who are feeling under the weather or potentially exposed just to walk into a walk-in health clinic or assessment center. We have to have special facilities or special handling for these cases. People who are sick with measles and require hospitalization. Again, the infection controls are quite labor intensive. It requires a lot of space, a lot of staff in order to ensure that that virus does not spread to others in the hospital, often others who may be immunocompromised for various reasons.
The province launched a new awareness campaign earlier this month. Changes have been made in making it easier to get vaccinated. How much of an impact is that having on the situation?
Yeah, I mean, advertising and advocacy are really the best tools we have. We just need to ensure there is a full press on this. And what I mean by that is, although there are some commercials out there, they're not coming up every day in multiple formats. In Calgary, I've only seen 2 or 3 of these commercials, despite the fact the campaign was launched nearly 2 weeks ago. So we really need to double down on this. We really need to convey that vaccines work, they're safe. We've been vaccinated for measles now for about 4 decades, and it was through vaccination that we were able to achieve a measles-free status for Canada, a status that we're at risk of losing over the next several months.
All right, well, we'll have to leave it there for time. As always, appreciate your time, Dr. Jenne. Thank you, sir.
Anytime, Michael. Take care.
Dr. Craig Jenne is an infectious diseases expert with the University of Calgary.